What should patients know before coming into your office?
Well, I like the patients to know about the procedure that they're interested in terms of the details, and that can be found online at my website, other websites. For example, breast augmentation. Placement of the implant, the anatomy, what it is they're looking for, some basic understanding. If they don't have it, then we discuss it with them before I see the patient with my staff. The other thing that I like patients to have, and besides a basic understanding of the procedure, is also to understand what it is they want to achieve. And the best way to do that is photographs. I like pictures of other patients that they find online, before and after pictures, to show me both what they like and what they don't like. Many patients typically bring in photographs of their girlfriends or such in bikinis, or pictures of bikini shots or such. That doesn't really help because, one, you don't know if it's photoshopped, and two, I can't really evaluate the breast fully when it's in a bikini. So the before and afters you find on other sites or my sites are very useful. And bring in both what you like and what you don't like, because what you don't like is as important, in many ways possibly more important, because it understands what we don't want to achieve. And then the next step is to understand what it is that it involves. That it's a surgery, it requires some time off, and how does that relate to your job, and can you take off, for example, a few days. For a breast aug, it's usually about a week, unless you do a job that requires lifting or some type of physical exertion. But if it's typical office or desk work, within a few days you go back to work with some precaution. And then the rest is to understand the potential complications. And that one's a hard one. So I typically have to discuss that with the patient. The potential complications are infection, bleeding after surgery. These are the most common complications after any surgery: bleeding, infection. With the breast augmentation, it's also, did you pick the right size? Did you go big enough or did you go too big? And all that. But that's also important to be discussed before surgery, so we're all clear on that. And then the rest is to have a really good consultation to be effective, both on my end as well as the patient's end, in terms of their understanding, appreciating the details and how they apply to them. And the rest is to proceed with a really wonderful surgery that's been well thought out, that has healed well, and attention to the healing, and as well, no complications. And I define good as what is a good surgeon? Well, a good surgeon is a surgeon that performs surgery, achieving what the patient wanted to achieve with very little complications. And I think that sums it up. And that comes from understanding, from knowledge, from paying attention to the details before surgery. So when the surgery happens, the rest is just good healing and good experience on the surgeon's part to deliver a good result. And also the patient understanding well what they need to do to heal well and optimize their results.